Hi, this is Barbara Howard here to tell you about CHADIS for mental health care. I'm a developmental behavioral pediatrician and faculty at Johns Hopkins, creator of CHADIS. CHADIS is a clinical process support system used across the United States. It's used for mental health care, comprises pre-visit data collection online, with online questionnaires completed by patients or caregivers, moment of care decision support and scored results, along with care coordination functionality for referrals, and post-visit patient-specific education and resources, as well as clinician education. This is a schematic of CHADIS with the patient or parent at the top right there, completing questionnaires from home. Other respondents do not see each other's results. The clinician gets those results and can share information with outside professionals, including teachers or other caregivers or therapists, and the patient gets patient-specific education in a care portal. The clinician can get different kinds of credit and can earn extra money when that's applicable on a state-by-state basis for these screening and diagnostic tools. CHADIS is easy to use. Once the office signs up for a license, they select from over the 200 questionnaires and screening tools for different types of visits and ages of patient. The office then asks the patient to log into CHADIS either when they make an appointment or by sending them an email or a letter. There's also a quick enroll possibility in the office for in-office completion. The respondents complete the auto-assigned questionnaires and the results are instantly available to the clinician. CHADIS is great for mental health care because it addresses all aspects of care. So considering triage, screening, and diagnosis, there's over 200 tools for child mental health care, including intake, screening, and diagnostic tools. There's over 90 adult tools in the categories of the major categories of diagnosis and for functionality and therapy tracking. There are family and environment tools and even general medical tools. There's also tools that the clinician completes while face-to-face with the patient. CHADIS can be done on any internet-connected device, including a smartphone. They simply click the radio buttons to enter their answers. There's also free text options. CHADIS can be presented one question at a time, and in Spanish as well as English, as well as French. The results come back to the clinician in English. The clinician results include the priorities for the visit, as well as a list of the questionnaires with the severity of the answers flagged on the left, and every questionnaire can be seen for the questions and answers that were given. There's some special functionality called a patient-specific template that helps with your decisions and documentation. This is a template for care, pre-populated by the questionnaire results, providing some links to decision support, including graphics in the case of ADHD, and the ability to generate a 504 and IEP plan customized to the patient. The auto text report can be pasted into the electronic record or printed out as a report to go back to the referring doctor. And we can provide a custom database report run at your convenience. Here's an example of a patient-specific template for ADHD. As you can see on the right, the data has already been filled in by the patient's entries. The clinician can add additional results, some of it by clicking, but also any amount of free text. And this is a great aid to documentation. For shared decision-making and monitoring, CHADIS has some graphic displays. This is a graphic display of the Vanderbilt over time, the colors reflecting the scores. Green is good, red is bad. And you can see both the parent over time and the teacher over time. Of course, you always get the numerical scores as well. For monitoring, CHADIS can schedule or have ad hoc reminders for patients to do questionnaires. They can receive these by SMS or email, and they continue to get reminded until they've completed the questionnaires. This allows remote respondents to provide data and also allows the patient to provide monitoring data, for example, for depression, as well as outcome data. This meshes with the care coordination functionality, allowing you to share data with specialists. One example of functionality for CHADIS is for social determinants of health. We have a variety of questionnaires, including the Safe Environment for Every Kid, which has been modified to the FAST that covers these social determinants associated with child maltreatment outcomes. In this case, the questionnaires again populate a patient-specific template, but the teleprompter provides motivational interviewing guidance that's specific to that patient, as well as sending educational materials to the care portal automatically and allowing for online consent for communication with outside agencies. This is an example of a graphic display to use with the patient. In this case, it's filled in the reasons not to act on, for example, in this case, intimate partner violence, and the reasons to act. This can be used in discussion with the patient, as you can see, and it's pre-populated by the results from the patient themselves. The patient-specific template for social determinants creates handouts with local and national resources specific to the patient's concern. And the patient education appears in a care portal. Now, for young children, the care portal includes developmental milestones, forming a baby book with suggestions for developmentally stimulating activities. For all patients, the care portal also includes visit notes, such as the one I just showed you with local and national resources, as well as handouts, some of them specific to the patient's concern, and some of them more generic. The patient can also search the database for information on their own, including local resources. CHADIS is perfect for integrated behavioral health care because it has the kinds of tools needed by both mental health clinicians and primary care clinicians. And the electronic connection can occur because people are co-located or using the care coordination functionality. We also have primary care provider training in aspects of mental health included within CHADIS. The care coordination functionality allows a patient to complete an online consent form during the visit, which is sent by either fax or email to an agency. This is all HIPAA and compliant and FERPA compliant. The agency can accept or decline the appointment. If they accept it, they can also have been given permission to contact the patient by the online consent form and can send back information about whether the patient kept the appointment, as well as sharing actual data over time with the primary care provider. CHADIS can make a registry of any data you want, and it's valuable for quality improvement projects and research. We can provide graphic displays and sample run charts are included here. And we can put in your custom forms and questionnaires, including your online consent form accepted by your IRB, reminding patients to do tools until they are complete, and allowing for remote monitoring as well as outcome. Then you can get a data dump at your request to analyze your own data. For clinicians in the United States, there's additional revenue available using a variety of codes for the different kinds of tools. The CHADIS license includes all of these things. There are some questionnaires from publishing houses where we have to charge extra, a la carte, and that is available at your request at a price never higher than what the publisher would charge you. Please contact us at info@chadis.com to get more information and to sign up. Thank you.